Okay, we're here with Wayne, and you're in the middle of having an all-on-4 treatment, which is a implant bridge on the lower arch. We're just showing some details of that to some people. Anyway, can you tell me, we first went from your teeth themselves to a 2-implant overdenture, and we did that at first probably because we told you about the all-on-4 option, which is kind of having a fixed bridge, but you kind of went with this first from some teeth. Can you tell us what it was like at first to lose your teeth, because you had some bad teeth that needed to be tidied up, and then what it was like to go to the 2-implant overdenture?
Well, from my teeth, I had a lot of problems with them. I knew I had to get them removed. Then I decided to go to the option with 2, but the problem was my teeth would not stay in place in my mouth. So then we decided to go with the 4 option, which is perfect for my situation.
So you had the 2 for how long?
2 for at least 4 months or more.
And what was it like for you?
It was hard to keep them in my mouth. They would not stay properly. They would go all over the place, and I had no good connection, no good suction for them to keep them down.
Yeah. So you had, you didn't have a lot of space for your flange. I remember we were talking about that. And the all-on-4 does not have a flange. And so the flange is this kind of part on the inside. Whereas this, we can see it doesn't have a flange. And that makes a huge difference for space on the lower. And also the fact that this has some movement, where this has 0 movement. And
that's correct.
So you found the movement. How do you find the all-on-4 now?
Oh, it's just like perfect. It's like I have, when I was a child, my teeth were that's how strong I find it.
And they look good.
I know.
Yeah, you have a good smile, and you're able to chew. Are you able to chew whatever you want?
Yes. The only problem is I have a denture up top, which will pop out when I have a good grip on my bottom.
Well, we could always fix that.
Yes, that's
we'll
right.
look at that in the future. And but thanks for telling what it's like for you, because I know that you did the 2-implant overdenture, and sometimes people do that because it's a little bit less costly, but there's not as much value in that. And is that kind of what you did at first?
Yes, I thought I could get away with that for the price, and it does not work. It's better to go with the 4 if you can see a problem with the 2.
Right. Because you're a strong biter compared to the average. Like it would be like you're driving a Maserati and you have a Honda, right?
That's correct.
And so now you have the Maserati, and I'm glad you're enjoying it.
Yes, very much.
Okay, thanks, Wayne. So from a dental standpoint, Wayne's jaw, you can see the 4 implants that we put in. The front 2 are positioned so that we could add 2 more later, and these are nicely positioned. They're way back, so I was able to get a good AP spread, so anterior posterior spread, which gives us like 4 table legs. And so this is transitional prosthesis, and so this is going to be basically temporary bridge. And we're doing an impression today, so we put the impression copings on. These are called multi-unit impression copings, and we're going to make them a final fixed bridge, which is then not going to move around either. So we attach these with some stabilizing wire and some resin, and we do a Improgum impression, which I'm a firm believer in having a nice rigid impression material here. So this is from 3M SP, and so we use a mono-inject syringe, which is loaded, and get that done. So we end up getting a nice impression for Wayne on the Prosto 1 all-on-4 appointment, and we send that off to the lab to be poured up. It's really important for the patient to understand the difference between a 2-implant overdenture, which is implants, and an all-on-4 case. So here the 2-implant overdenture does have some movement. It's really appropriate for many, many people, but you need to have a good saddle in the posterior, a nice fitting denture with good border molding, and if you have all that, they can be quite successful. However, if a patient has a large tongue, it pushes their tongue backwards and causes more apnea issues, and so that's important to assess before you do that type of treatment, because cost is not the only factor. So you have to make sure that they understand that, and I did spend a lot of time with Wayne talking about that. Now, if we look at the all-on-4 option, if we put the 2 implants in the anterior in the right spot, we can come back and add more implants. And I told him we could do this, and he said, I want to add those implants. So it added more cost. He was very happy to pay that, and feels that it's a much better option for him. And so it depends on the patient whether they can do option 1 or option 2, but both are very kind of unique, and the all-in-4 option is definitely a fantastic option, and something that the patients really like when they have it. It changes their life. It makes it so that they can eat properly and function and smile. You can see his confidence was up with having this prosthesis. So this is Dr. Scott MacLean, and this has been a video about implantology. And hopefully this will help you and your patient to decide what's best for them, because it is about what's best for the patient.